Department of Health says the Polokwane municipality has agreed to supply Seshego Hospital with water tankers. The hospital has been battling a water crisis as its reservoirs are not filling up to sustain the flow. Some of the patients, including pregnant women, were recently seen on social media carrying buckets of water. We're now joined by the Health MEC, Dr. Popi Ramatuba. Thank you very much for your time this afternoon, ma'am. To your knowledge, what's going on?
Afternoon to you and all your viewers out there. I went to visit the hospital yesterday after the social media picture that was sent to me. What I could discover is that, yes, we know that Polokwane, like some parts of the province and the country, do experience challenges of water from time and again. And the municipality at times, like today, they just issued an MM. Then what was done as a proactive measure is that the hospital Seshego has got a storage dam which can last up to 48 hours if it's full to capacity. We also have got a reservoir that is also can assist during that period. So the Seshego Hospital is situated in Zone 1, which is not a low-lying area, it's high. And therefore, the supply of water, when it comes from the municipality, we are experiencing a lot of challenges at Zone 1 compared to areas like Zone 5 in Seshego. There we don't have challenges. Now, the agreement was that whenever there is a challenge, like currently, a municipality experiencing challenges, there should be 10 trucks of water that are going to be supplied on a daily basis, which will fill in our reservoir and also our storage dam that is there. Now, we don't know exactly what has happened on that day because my findings from engaging the hospital management, they are indicating that, yes, at times they will have such challenges, but they always become proactive and inform either the executive mayor or the municipal manager, who, without fail, they always tried to come to their rescue. Now, the other area, when I went to the ward, the maternity ward, I could find that beside the reservoir that are there, the wards for themselves, they've been proactive and put some JoJo tanks and some drums of water, which are always filled with water in case those reservoir and the municipality is not able to supply water, so that basic water for bathing, it's not a problem while we are finding permanent solutions from municipality to get us water in the hospital. Now, the question that you are asking, which I also was very worried, is about patients being subjected to carry water. Nobody wants to admit what has happened. How I wish we could get exactly on which day was this video taken, because yesterday the water was coming out, even today. So we don't know whether it was taken on Sunday or when was it taken. We don't know, because we need to get to the bottom of it to say who was on duty on that day and understand, because we are hearing a different story from the management. We do have cameras within the facility and especially towards the maternity area, which were going to assist us to find out exactly what has happened. But checking in those days that we know there was a challenge, we are not able to really find out exactly what has happened. But yes, the issue of water is a challenge. The second issue that I can indicate is that we took a decision to say, because the municipality sometimes also has got its own pressure, which is well known to all of us. And equally, the reservoir get finished at times and we don't get trucks coming. We are now exploring, as I speak, our engineers are on site exploring underground water because last time we had a challenge. We are hoping that this time we will be able to find areas around Seshego Hospital where we can drill borehole water so that we know we don't experience this problem anymore. Because with our boreholes, they will be reliable. We will also make sure that our boreholes are connected to alternative energy, Because one of the issues which is...
Dr. Ramatuba, if you please just allow me to join you, ma'am. These that you characterize as challenges, for how long have they been going on at this particular hospital?
The challenges that we are currently facing now, it's not something that you can say it has been on for 2 days or a week. This is something that you would find this month we don't experience challenges with municipality. But this particular week, some days, there's supply water. So that is why the hospital has never escalated the matter to my office. Because to them, it had not reached that crisis point. But one has indicated to them yesterday that they should have informed us even when they thought they could manage the problem, because they should understand that one day it becomes a time bomb and somebody make a big issue. Otherwise, this issue of continuously exploring the boreholes, we would have done it as the department, like we've done in other facilities where we realize that our municipality are not able to meet our demands, especially as a hospital. Hospitals require a lot of water in order to survive.
Maybe in terms of this exploration of boreholes, what happens? Where's the process? We appreciate that you only went to the hospital yesterday to see, but given that we know that it's at a high-lying area, and so it will be met with challenges. You've got JoJo tanks at a hospital that's got maternity wards. It's not a sustainable situation, and so given the situation has been going on for so long, what are the timelines in order to rectify the situation? Surely this is desperate, no?
That's why from today, by end of business today, I should be getting the report from engineers. They are best. I'm not best in that area. They are appointed to help us to know exactly when. So I've indicated to them that by today, end of business, we should know if we are having water within the hospitals. If the water is not within the hospital yard, we don't have underground water. They should explore in the nearby areas. Where can they, like we've done in Philadelphia Hospital. We will have to do everything in our power to make sure that we get alternative way that is sustainable. But in the meantime, I must reassure the citizens that we have had discussions with the executive mayor, with the municipal managers, and come up with the ways of monitoring the delivery of water through trucks by municipality. Because the problem is that we had left the issue to be dealt with by our administrators at a lower level. That's what I was raising with the CEO to say, you personally as a CEO should be able to, on a daily basis, check your reservoir, check your dams. If they are empty, call the municipal manager personally yourself, because this is a hospital. There's no any alternative to water. You can't operate without that. But I must also indicate to say, the members of community, we are not saying we are gagging them from exercising their rights of taking videos and pictures. My question would be, because the hospital and some of the community leaders are bringing allegations that people stage the issue of a pregnant woman. But all I'm saying is that we could have done it different. When you find a pregnant woman carrying water in the bucket on the head, the risk here is that she can slip and fall and lose that unborn child. Why not taking that bucket? Take yourself a video while you are helping that pregnant woman and send it to us to say, look how brutal and cruel your hospitals are. But to allow a pregnant woman to walk from the JoJo tank where she was fetching water, which is quite funny because they said there was no water, but the water was collected from a JoJo tank in the hospital to the wards. So that is the area which we are saying that even if we want to be malicious, please let's not use the patients. They deal with us on the other way, but when you come to patients, worst scenario, a pregnant woman, subjecting them to that, it really one day will go in a manner which we will not be able to reverse whatever unwanted incidences that would happen. It could be disastrous, and we could then lose a life of an unborn child and a mother.
Dr. Ramatuba, we've had a number of conversations with you throughout the course of 2023, more so when it comes to situations like these, right, where something happens, it is captured on video, and then the MEC comes in to rectify the situation. I do wish we had maybe informed you a little bit earlier on, perhaps to get a progress report in terms of all those other interviews that we have done where there were problems in Limpopo. But for the purpose of now and just maybe taking a look at the future, what should this tell us about the state of healthcare in Limpopo? Is it fair to say that it's on its knees? Because if Dr. Ramatuba always has to come on television or radio or newspapers to put out fires, what does that tell us about the state of healthcare in Limpopo, where pregnant women are allegedly subjected to such? And it's not just pregnant women. Just last month you were on air talking about the security guard that was turning people away from hospitals in Limpopo.
I think I would appreciate if you were to give me some of those incidents and try to find out what has happened. For instance, if you give us an incident of a security guard refusing a patient, triaging a patient, consequence management has happened, that cannot on its own made you to conclude that the department is on its knees. This is a human being who is just heartless. When we are heartless in our nature, we are heartless. How many times have you and I try to enter an area and the security guard just becomes stubborn for no reasons? And in this era, the security guard decided to do things that they are not employed to do, which is triaging a patient. It had nothing to do with the clinic is not operating 24 hours. It had nothing to do with the department has failed to provide health care. It's an individual, which we must deal with individuals. Because the nature of the Department of Health, because it's labor intensive, it deals with human beings. Human beings on a constant basis will continue to make mistakes because we are not the same. No, that's why sometimes you will get reports that it will be coming alarming. When somebody took a video of a woman carrying water in the bucket, firstly, me and you must question, because it's like when you see me drowning and you take a big video of me without helping me. When you see me being assaulted as a woman by my husband, you take a video and you don't assist me. I'm not saying people must not take videos. I'm saying we must also assist, unless we have got our own shenanigans that we want to prove. Now, the Department of Health has seriously improved. If you are to ask me, what have we done? You have asked us about ambulances when we started our term of office. You can see that how much we are improving to buy 500 ambulances in one financial year. It has never happened, and we've been able to put our resources together. If you look at medical equipment that previously, when we started, they were complaining that the province doesn't even have MRI scan. Today we've already delivered another one at Mankweng. We are expecting another one early in the year for Polokwane. If you look at CT scans, that in the beginning, patients will even travel to George Mukar for a CT scan. Today, patients in St. Rita's, Sikukune, they have CT scan in Bembe, Chirizini. I'm talking about rural areas where, you go to Mopani, you'll find Litaba, you go to Waterberg, you'll find Mukopani. This is a province that when we started, we had around 20 medical specialists. Today, we pride ourselves as we moved up that you are talking about, that are systematic. We are working on them to try to improve. But there are those challenges that are as a result of attitudes of staff. We've got to work together with you and assist us to deal with the attitude of staff. Because that one is not something that you can eradicate over a one day. It's just, if a human being is just heartless, it takes baruti, it takes how you were raised. As I'm speaking now, I've just finished addressing an oath taking of our medical students, the health and all the health faculty at the University of Limpopo. This is the first ever school of medicine established post 1994. This is the administration. During our first administration, we established this medical school. It was not there. For you to have a medical school, you need to have teachers. who are consultants, specialists. They were not there. So you can see the progress that we are making. This is my third group as an MEC to graduate as medical doctors from the University of Limpopo. It has never happened.
All right. Thank you so much, Doc, for your time this afternoon. Limpopo Health MEC, Dr. Poppy Ramathuba.